Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for tuning into this latest video. I hope you're all keeping well and safe. So this lady found me via YouTube. She previously had ear irrigation performed many years ago and felt that the procedure, when performed in her right ear, caused her some permanent hearing loss. And therefore she's very reluctant to undergo ear irrigation again. Every procedure of earwax, every technique has all got potential complications, side effects, risks, and one of those is either a temporary or permanent loss of hearing. So even with microsuction, so when you perform microsuction, it's quite noisy. As such, I decided to try and remove this wax using completely dry instruments, hooks and scoops. So I started off with an ear hook and I then resorted to a Jobson horn, and fortunately the wax was quite lateral, so towards the outer part of the ear canal there was an opening for me to insert the ear hook and Jobson horn in and behind the wax to extract. The texture of the wax also was suitable for use with an ear hook and Jobson horn. If the wax was really wet and runny, you wouldn't be able to use a Jobson horn or ear hook. It was just that nice consistency. It's almost like a fudge consistency. There's the tympanic membrane, so the eardrum, it's nice and healthy. It did appear slightly retracted, so buckled inwards. However, I did a pressure test called tympanometry post-procedure, and that revealed the middle ear pressure to be equal to the atmospheric ear pressure. So that was the left ear. We're just on the right side now. Again, there was an opening for me to insert the Jobson horn in and behind the earwax. This ear canal entrance is slightly more narrow and slit. So there's a huge piece of wax here. It's been in the ear for a while. You can see it's quite dark, and therefore it's oxidized. The darker the earwax, generally the longer it's been inside the ear. So the right ear was a bit more impacted, quite possibly because the ear canal entrance aperture is a bit more narrower, so the wax is trying to work itself out naturally, however it's getting blocked near the entrance. The wax is also a bit deeper in the ear, so we've just got to be careful with the Jobson horn. We don't want to make contact with the bony part of the ear canal. So the outer third of the ear canal is cartilaginous. It's made up of cartilage and a layer of skin approximately 1 millimeter in thickness. The outer part of the ear canal also bears all the hair follicles, so that's why we see the cilia, the hair strands near the entrance, and the outer third of the ear canal. The outer third of the ear canal, so the cartilaginous portion, is also semi-flexible, so we can manipulate it slightly, and it's semi-sensitive, so you can't apply too much pressure, but you can apply some pressure, especially in comparison to the inner 2/3 of the ear canal. So you can see here with the Jobson horn, we're applying some pressure on the outer third only, the cartilaginous portion. If we were doing that on the inner 2/3, the bony part of the ear canal, the patient would be not very happy with me, to put it mildly. It'd be very uncomfortable for them. So the inner 2/3 of the ear canal, it's made up of bone and a very thin layer of skin, probably 1/10, 1/15 of the thickness of the outer layer. That's coating the cartilaginous portion. And this skin is tightly adhered, wrapped over the bone. There's no fatty tissue, no muscle there. It's literally skin on bone. So if you do come in contact with that, it would be very uncomfortable. So just using a Jobson horn just to mop up. There you can see the patient's eardrum. You can also see the patient's incus, which I've circled. So the incus is the second middle ear bone. It's not always visible. However, if you've got a very translucent eardrum, it can be seen, visualised through the eardrum. There's all the contents of the earwax from both ears. There's the ear hook and Jobson horn. I also measured the wax, so it weighed in at 546 milligrams, so just over half a gram. I hope you enjoyed that video, guys. I hope you're keeping well and safe and you're having an enjoyable evening. Thank you, bye.